I'm Dan Zhang. I'm a Korean medical doctor and a licensed acupuncturist in Washington, D.C. and Virginia. Now I'm practicing in McLean in Virginia. Mm, Early on, I did a 1 hour free webinar for knee osteoarthritis, tips and tricks for the knee osteoarthritis, hosted by Lhasa OMS. And today I want to give you a supplement data about about the real case, because the real case uh, inspires you about the new information and how I manage the patient and how I do all the physical examinations. So let's get started. And it is uploaded in the YouTube, so you may be able to see through the YouTube once again. And let me show you one by one how I did every single step for the diagnosis and treatment. So that. Because I'm using dual screen, it's so confusing. Maybe you can see now. So let's see. This is case. And first of all, I have to show my gratitude to this patient who agreed to show this video for the educational purpose. And thanks for your courtesy for sharing this. Okay, let me show you the real case. Okay, the first step I do for the knee pain patient is squat, like this. Yes, I let the patient do the squat 3 times more. So that means the first step for the knee for a physical examination should be squat. A squat, even though it's such a small thing, but it gives a lot of information about the patient's knee. First of all, if the patient is older than 55 or so, the full squat range means the patient is less likely to have knee osteoarthritis. And the second one, the full squat means the patient has low chances for the meniscal injury or the anterior ACL injury, anterior cruciate ligament injury. And the third one, the patient is less likely to have fluid effusion, which keeps them away from the full squat. That means if the patient is able to do the full squat, they are less likely to have knee osteoarthritis, meniscal injury, ACL injury, or unusual fluid effusion. So we can exclude a lot of things from the single test. The next test is for the muscle strength test. Let me show you in detail. The first one is vastus lateralis medialis, and the third one, the first and second one is vastus lateralis and medialis, and the third one is the tensor fascia latae. Let me see. Let me show you. So the first one is yes, vastus lateralis. I changed the direction inferolaterally to the vastus medialis. You may see the patient body is shaking. So this video was taken in her third session, and first session was focused on the shoulder, and she showed such a good result. So in the second visit, she complained about her knee pain as well. So I did the second treatment focused on the lateral part of the vastus, right vastus lateralis. And thankfully, on the third visit, she allowed me to shot this video. And this video shows less weakness on her right vastus lateralis than the second visit, which showed the effectiveness of the acupuncture. And the last muscle that I test is tensor fasciae latae. Let's focus on that. I internally rotated the leg, and I'm using 2 fingers to give some resistance for the leg. And the direction goes to the contralateral ankle. You can see that it's shaking a lot. So to reduce the resistance, I used my pinky finger. You can see the shaking. But definitely be better than last time. So in conclusion, for the muscle strength test, I can check the general quadriceps femoris muscle for the left and the right. But to do it more in depth, I can divide it into 3 parts. So the medially, I can check the vastus medialis by exerting my resistance inferior laterally. That means the vastus medialis will be the primary muscle that oppose my resistance. The next one is vastus lateralis. I'm that way to check the vastus lateralis. I impose my resistance inferiorly and medially. And for the tensor fasciae latae, I go 45 degrees diagonally into the opposite ankle. And you may be able, was able to see my physical examinations. The muscle strength test was really gentle. It didn't went abruptly, and I'm seeing the muscle weakness for 5 seconds. And most of the time, the weakness comes after 3 seconds. So you have to listen. You have to listen to the muscle, not for the first 1 or 2 seconds. You have to look over 5 seconds to see the subtle or minor differences. And the third test that I do for the knee pain patient is patellar test, which is a really good test to see the patellofemoral joint, which is really crucial and closely relevant to the knee pain. And that slide was mentioned in my 1-hour free webinar. So if you are interested in about that, please refer to that video. Let me show you the patellar gliding test. I do 2 direction, no gliding. First one I'm just pressing gently and go up and down, and then I go side to side. The reason why the patient is laughing is that for the left side, I couldn't make any click or any pop. But for the right side, every time I go up and down, the patient and I both can feel the click or pop. So that's the reason why the patient is laughing. And interestingly, for the lateral side, the patient shows more click. And for someone who is really sensitive, may have noticed that her circumference for both legs are different. I measured the circumference from about 3 inches above from the upper border of the patella, and the difference was about 3/4 of an inch. The left side was bigger than the right side, about 3/4 of an inch. And it was related to the instability of the patella movement on the right side. And let me show you the 4th test that I do for the knee assessment. I can do pinchy roll over the thigh. If the patient shows hypersensitivity or some tenderness or pain tightness on the thigh, we can infer two things. First one is that maybe the dermatome coming from a specific spinal nerve into the lateral thigh or medial thigh may have been irritated somewhere around the Watajiaji point, or locally the muscle contraction reacts as a lubricator between the muscle itself, the skin, and all the connective tissues between between those, and it is called fascia. Once the fascia is not movable as it should be, then the patient may feel some tightness. So we can think about two possibilities about the unusual feeling coming from the pinch roll. This is the way I do the pinch roll over the thigh, observing the medial and lateral side. I can figure out the margin. Where is the tightness or where isn't? Okay. So in brief, my clinical reasoning goes like this. After a squat, I was able to figure out that there is no remarkable signs for the osteoarthritis or meniscal disruption or ACL tear or no abnormal fluid effusion. And then I just get the passive range of motion because the squat was normal. And in terms of muscle strength test, the patient showed weakness on the right vastus lateralis and the tensor fascia latae. For the patella gliding, the patient showed repeated clicks on the right side, especially for the lateral side, which is related to the weakness of the vastus lateralis. And the pinch roll could confirm the unusual muscle on the lateral thigh. So I ruled out this patient as a patellofemoral pain syndrome due to vastus lateralis and tensor fascia latae weakness. And I want to show you additional videos about this patient, the acupuncture treatment itself briefly, and then after the treatment, I reassessed that patient. Let me show you the video. You can see the video through my YouTube channel. Let me show you the acupuncture, how I put needles into the patient body. It's really simple. So I put 6 needles into the sensitive area. The needle size is 0.2 millimeter diameter and 30 millimeter length needle by BBC from Korea. The first 3 needles went into the vastus lateralis, and the latter 3 went into the anterior part of the iliotibial band. Additionally, I put needles into stomach 37 and spleen 10 or GB 34, which is the most important. Those are the most important acupoints around the knee. And let me show you the electrical stimulation. Maybe you can see the twitch induced by the electricity. So this is the way I treat the patient. It's really simple. Only 9 needles and 3 needles went into, and the 3 needles went into the vastus lateralis, and the other 3 needles into the anterior margin of the. Reassess the patient through the muscle strength test. So So just after pulling out the needles, I was checking the vastus lateralis. So please pay attention to the vastus lateralis. And no difference, and her body wasn't shaking at all. So for more challenge, I did a little abruptly and strongly. She felt a very mild weakness, and for the pinch roll, so the patient felt that it's so soft after the treatment. And with this case report, I reminded you the 1 hour webinar about the knee osteoarthritis, which was done last week. You can see the link through my YouTube channel. And the key factors about the knee osteoarthritis is that we have to look into the patellofemoral cartilage and the patellofemoral joint. We have to check the muscle weakness, and we can stimulate the muscle through proper acupuncture and electrical stimulation. That was the key message through my 1 hour webinar, and I was really glad to share this video with you guys about the real case showing much improvement after proper treatment, which is based on the thorough physical examination. And these mechanisms work together, work same to the osteoarthritis patient or other cases such as lumbar originated knee pain or some kind of postural twist. So later on, if I have more cases and if the patient allows me to shot those videos, I'm going to share more videos with you. Thanks for watching, and let me show you another cases later on. Thank you for coming. Bye.